So hi everyone, thank you so much for tuning in and watching this video. Today I'm joined by Dr. Naidoo, the author of This Is Your Brain on Food. In her book, she draws on cutting-edge research to explain the many ways in which food contributes to our mental health and shows how a sound diet can help treat and prevent a wide range of psychological and cognitive health issues. Dr. Naidoo is a Harvard-trained psychiatrist, a professional chef, and a trained nutrition specialist. She founded and directs the first hospital-based nutritional psychiatry service in the United States and is the director of nutritional and lifestyle psychiatry at Massachusetts General Hospital, while also serving on the faculty at Harvard Medical School. She's considered Harvard's food and mood expert and has been featured in the Wall Street Journal, ABC News, CNBC, Healthline, and a number of other prominent news and media outlets. Dr. Naidoo, thank you so much for being here.
Thanks so much for inviting me, Con. I'm happy to be here.
Great, thank you. So first question is, could you just talk briefly about what nutritional psychiatry is and what led you to this field in the first place?
Sure. It's although the terminology for nutrition and mental health being called nutritional psychiatry is a newer term that not everyone has heard about and maybe has existed for between 5 to 10 years now. The reality is that in mental health, we've been looking at individual nutrients and different impacts of these nutrients on mental health and mental well-being for decades. Some of my mentors studied methylfolate and folate and the effect on depression. Others of my mentors studied the omega-3 fatty acids and the impact on depression and the brain, as well as bipolar disorder and several other conditions. And it really is, the way I like to explain it, Con, is think about how you eat a meal. You know, you don't eat one nutrient or one ingredient. You tend to eat a composed plate of food. Well, in a similar way, you know, the impact on our body and most importantly, our brain, because of my interest, is really about how we feed ourselves and what we feed ourselves and the combination that we do. And it's putting together the science behind the nutrients and their impact in mental health. So in my book, which I will show you, called This Is Your Brain on Food. It was just released. It was just released in August. I found that my patients were coming in quite confused about how to interpret nutrition information. And, you know, because I've studied various things, and I'll go into that in a moment, it seemed to make sense to help them not only eat better for their better mental health, but also provide some updated information and research on what's going on and what we know at this point in time. That's really what led to the book. My work in nutrition and mental health or nutritional psychiatry really began because of my personal interests in believing that mental health should be integrated with other forms of healthcare. And it's not just one thing or one dimension. It's really about a holistic model of care where your different specialists, if you're seeing them, may all speak to each other. But also you think about your brain as part of this. Many people go to their doctors and talk about a diet for a family history of diabetes or if they have a high cholesterol, but no one talks about their brain health and nutrition. It really is a missing gap. And then there was the gap of nutrition in medical school education. There's some medical schools in the US which have doing better than others in integrating a more, let's say, a broader level of nutrition and culinary medicine into the curriculum. But there are many, even worldwide, where there's a very limited amount of nutrition. So to me, that was a gap, and I needed to fill that in my life. But also, as I learned more and more about mental health, my specialty in psychiatry and the medications that I'm prescribing, I realized that they have many devastating side effects. And I needed, because of coming from that holistic integrated model of thinking, that I really wanted my patients to have more tools in their toolbox or their toolkit to feel better. So nutrition is one of those things, and it's something that any one of us can do right now. We can make a decision about what we eat. So it's also very empowering to people because it's something that they can decide on their own versus a medication, which is a prescription, and there's so many things about that. I very frequently prescribe medications. I am an allopathic trained physician, and I think that medications have saved the lives of many of my patients, but I don't think it's the only route. I think it's more than one ways that we can help people feel better. And that's really how I came to do what I do.
Great. Yeah, no, I couldn't agree more. I mean, I think just from what I've researched and seen, like in the past, we think of we used to think of the brain as being separate, like a completely separate entity, and mental health issues as being their own individual diseases, and not thinking about the connection to other parts of the body that might influence the brain. Um,
Absolutely.
and so, and much of your work is focused on the two-way connection between the gut and the brain specifically. And so, in your book, you talk about how the foods we eat influence our gut microbiome, or the bacterial species that are found in our gut. Could you talk a little
Yes.
bit more about the brain-gut connection and how our gut bacteria can influence our mental health?
Sure. So it turns out that the the cells in embryo, as we taking us back to biology class, when we each are a little embryo, the cells that go to form the gut and the cells that go to form the brain are the same. They divide, they grow, and these organs become formed, and they separate out in the body, but they actually arise from the same cells called neural crest cells. And in addition to that, even though the gut and the brain are far apart in the body, the second factor is that they're connected by the 10th cranial nerve called the vagus nerve. And the vagus nerve connects those two organs throughout our lives. And it also acts as a two-way superhighway for chemical messages back and forth in a bidirectional way between the gut and the brain, and the brain and the gut. Two other factors which I feel important for people to know is that serotonin is frequently called the happiness hormone, and if anyone knows about medications like Prozac or Zoloft, otherwise called fluoxetine or sertraline, these are selective serotonin reuptake inhibitors. That's the mechanism of action. But more than 90% of the serotonin receptors are found in the gut. So often as someone is prescribed such a medication, they may initially have gastrointestinal side effects. And it makes sense why, but it also makes sense that the food we eat would then impact how we feel emotionally, because the receptors are right there as well.
Mm-hmm.
In this age and with what we're all going through, it's also really important for people to know that a very large component of the immune system is in the gut. And therefore, I focus on mental health and I focus on brain health, but our bodies are combined. We have multiple organs, they all act together.
Mm-hmm.
So paying attention to our immunity and how that impacts mental health is also important. And therefore, the gut-brain connection becomes significant because you eat food, it begins to be digested, and it continues being digested in your gut. And you can make a decision on any given day, Connor, to go to the fast food restaurant or the fast food lane, or to eat a healthy, maybe a home cooked meal or a healthier meal, a healthier option.
Mm-hmm.
And in that 24-hour period, your gut microbes will change. They will either change in a good way, with a good option for food, or not a not good way, because the balance of the microbes in the gut, even though you don't feel it immediately in that 24-hour period, it starts to evolve over time. So if you're continuing to go to the fast food lane and eat those types of foods, which we know are not the best for us, your gut bacteria are going to evolve in a way that's not good for your gut health and therefore your mental health. What do I mean by that? There are 39 trillion microbes in your gut,
Mm-hmm.
at least, different types of organisms, and you want that army of organisms to be working for you. The moment that you start to veer away and eat the foods with higher sugar or added sugars, the foods that are fried foods and high in trans fats and processed foods and fast foods, then the bad bacteria start to overcome the good ones. And when they take over, it really is the beginning of the setup for inflammation, which can show up in many different ways in the body. But for the purposes of my work, the inflammation in the gut leads to inflammation in the brain called neuroinflammation. And that is where foods that we eat become so important, because over time, people can then present with mental health symptoms.
Okay. And so the mental health symptoms can somewhat be attributed to that neuroinflammation, essentially, is kind of what you're saying.
Exactly. And
Okay.
and it starts off because those feedback signals going back from the gut are not good. The ones
Okay.
that are going back are inflammatory. Let's say they're setting up inflammation. So someone with whatever. I like to say a happy gut is a happy mood, because if you keep your gut happy, you generally are going to be in a better state of balance. Of course, it's more complicated than that, and there are many more conditions that I discuss in the book. But that's a basic principle for us to understand as to why food matters.
Okay, great. Thank you so much. And so, like you said earlier, medication is absolutely necessary for a lot of patients and can be a lifesaver for many people. But in your book, you also mentioned that you've had patients that have been able to either come off their medications entirely or significantly reduce the dosage just through dietary interventions. Could you share an example of that from your practice and maybe talk about how that's impacted you personally, seeing that change in your patients?
Sure. The first thing I like to preface this part of the conversation, Connor, by saying that, medications are life-saving in certain situations. So someone who's actively suicidal, someone who's manic from an episode of bipolar disorder illness, someone who's losing touch with reality and is psychotic, any of those conditions, or if someone is even so depressed that they can't get out of bed, those are conditions where you need to be calling for help, going to an emergency room, speaking to your doctor, maybe needing medications initially. None of those things preclude or exclude the use of food. You can always try to eat healthier because that's only going to help the process. That being said, there are individuals who don't always fall into a specific diagnostic category in the Diagnostic and Statistical Manual that we are expected to use in psychiatry. And in fact, many people don't fit into those and also are suffering in some way. But they're able to function, and they can be very amenable to healthy habit changes, including how they're eating, as part of a whole treatment model that I designed around better mental health. So, in the book I focus in on the nutrition, but it's also about, sleeping well. It's about hydrating. It's about exercise, mindfulness, mindful eating, so many different components. Or maybe, it's yoga, Tai Chi, Qigong. It's whatever appeals to you that settles down your system and makes you function optimally with the use of food. Stress is a very big driver of illness and that we've come to see in medicine. And so I think it's very important to approach disease models in that way. And coming to patient examples, I think one of my most profound examples is a young woman who wasn't on medication but came in to see me because she was desperate to get on medications. She had been referred to me by her gastroenterologist. And a young woman who'd never seen a psychiatrist before, very panicked because she had developed new onset anxiety with panic disorder. But as I took the careful history, what I uncovered was that about 18 months prior, her life had changed in a good way. She'd gotten a great promotion at work, but this promotion meant that she had to do a lot of travel for sales in her role, and she was really doing very well, highly successful, being acknowledged in her company, but she was barely home anymore. And previously taking lunch to work, having snacks that she brought to work, having, home-cooked dinners most nights of the week, except maybe an evening or two out. She was now on the road, flying, eating in airports, eating in fast food restaurants, arriving at hotels late and eating whatever snack she could get out of the bar fridge, having more wine with dinner because she was at business meetings so often, which was not her usual style. And all of this had in fact disrupted her gut microbiome. And, even though she was exercising and doing other things, it really was too overwhelming for her system. And when we it took time, but when we started to correct her diet in the right direction to what she was more used to eating, and really allowed time for her gut to heal by eating, fiber-rich foods. So things like a plant-rich diet, things with nuts, seeds, some low glycemic fruit like berries, healthy whole grains, lentils, legumes, and then other things that fortify the gut. You cannot get fiber from seafood or animal protein. So the fiber really helps to start fortifying the gut because it gives those gut bugs food to eat that they need and to thrive. So by making some simple tweaks, it was part of a whole plan. She was able to get better and avoid taking medications, which she was very relieved about.
Yeah, that's amazing, especially considering, the cost associated with medications, the side effects, like you mentioned earlier, all those things. And oftentimes eating healthier too can be cheaper in certain situations. Like if
Yeah,
you're, cooking at
absolutely.
home and you have the ability. And so, yeah, that's pretty amazing. Yeah.
Absolutely. It's definitely more cost effective. And studies have shown two things. They've shown that when you eat at home, you consume fewer calories. And the second thing they showed in a very large study was that when you eat at home, even if you're not following a healthy diet, you still consume fewer calories because you're automatically just eating healthier.
Mm-hmm. Yeah, that's very true. Um, okay, next question is, what has been the most rewarding part of your practice as a nutritional psychiatrist?
It has been seeing people embrace this model of care and these um, individualized treatment plans that I put together for them, and seeing people succeed and feel better emotionally is a very powerful thing, because prior to that, prior to really investing my time in this type of work, the only times that I would see that is if someone was on a medication, but sometimes that also came with side effects. And so that has been very fulfilling. And the other part of it surprised me, Connor, because I'm a hospital-based physician, and it's only since my book came out in August that I've been on social media or doing interviews like this with you. And it really hadn't been that my work was out in the world in that way. And I think that when people respond positively or actually feel, I've had people write and tweet and all these various ways that people get in touch, or some people have just written to me in the hospital and told me what the impact of the book has been. And that has been very, very very, very fulfilling to me, because people have said it's been a guide to them through the pandemic, that they've struggled at the beginning of the pandemic. They're trying to find ways to self-correct that path. And the book has really brought them good new ideas about just how to eat healthy again and how to start with some basic building blocks. And they know by doing that, they don't have to have a diagnosis in mental health, but that they're fortifying their mental health. And that's been actually one of the surprisingly positive things about releasing a book during a pandemic. So,
Yeah, no, it's definitely a unique time to let that come out. But yeah, the book is amazing. I can't recommend it enough for anyone
thank
who's
you.
interested in improving their mental health. And like Dr. Naidoo said, you don't need to have a diagnosed or a previously diagnosed mental health condition to benefit. So yeah, and just one final question, if that's okay.
Sure.
So what advice would you give to someone that's interested in pursuing a career in nutritional psychiatry?
So, Connor, that's a really great question, and it is a newer field, and there are research groups overseas and internationally that are studying this field, studying this area. There are individuals like myself and a few others that practice this way. The Institute of Lifestyle Medicine and the functional medicine doctors in the United States really believe that food makes a difference, and they are proponents of this kind of work. But it is newer in the sense that it's not integrated into mainstream psychiatry yet, meaning that if one of you listening to this goes and sees a psychiatrist, they may not ask you anything about your diet.
Mm-hmm.
Your primary care physician might, and your gastroenterologist might, but unlikely that your psychiatrist will. And where I'm trying to make a change in that is I am designing a program where we will start to help educate and train other clinicians, not just doctors, but any clinician who, even coaches that want to speak to people that have some of the research behind it and understanding of how to do it. So I think that it's a field that will grow, and certainly provide ways that individuals like yourself and others who might be interested in learning more or understanding more or practicing using this as a tool in your practice will have more resources as we develop it.
Great. Thank you so much, Dr. Naidoo. And like I said earlier, definitely check out the book. This is Your Brain on Food. It's available on Amazon and virtually any book selling website. So yeah, thank you again, Dr. Naidoo, and I really appreciate your time.
Thanks, Connor. I just want to ask everyone to please follow us on social if you're interested. We put out information all the time, and I think you might like it. It's at DrUmanaidoo, which is at Dr. Uma Naidoo. Thanks so much, Connor. I appreciate it.
All right. Thank you, Dr. Naidoo.
Take care.
You too. Bye.